Hey guys, Tony here. So I want to read a post that came in through my Medicare billing Facebook group, and I'm going to share my response to the 3 questions at the end of the post. So this was from a therapist who had been treating a Medicare beneficiary. The Medicare beneficiary was receiving Medicare Part A home health, and so this therapist was delivering supplemental services, additional services that weren't medically necessary because the patient was already on a prescribed home health plan of care, but the patient or the patient's family wanted more than what was medically necessary. Okay, so let me read through this a little bit. So this therapist says, I have a client, I've been seeing the patient private pay to supplement what the home health therapy has been doing since February. This post was in September. Home health is still in and plans to discharge in 6 weeks. She, meaning the patient, has made remarkable progress from nearly dependent for all ADLs and functional mobility to standby assist, from walker level to mod assist, independent, and wheelchair. Her current goals focus on expanding her would safely enter the home, which has standard steps. She can now do her home with a ramp and 4-inch step standby assist, transferring to a variety of chair heights. Her last goal was to continue to improve her dynamic reaching, focusing on shoulder strength. I had always planned to transition her to Med B, but home health is still under an active plan of care. I feel after the next 6 weeks she'll have plateaued. She will likely want me to continue to keep her, quote, accountable to her home program and walk with her. Okay, so before I even go any further, obviously keeping her accountable, huge value in that, not a covered service. This person recognizes that, that's why they're putting it here, and continue to walk with her. All self-pay services, perfect. I have a signed plan of care in place from her doctor. She works diligently with her caregiver, so I would be in once a week. Question number 1, how do I transition to coaching? Question number 2, do you still have signed plans of care? Question number 3, does this remain a self-pay service? So I would say, from a Medicare Part B coverage policy or coverage standpoint, I agree with what you're doing. Like, if by the time the patient is discharged from home health, you could probably justify providing a Medicare covered initial evaluation because there's a transition going from home health Part A potentially to or outpatient in the home under Part B. If you read through the Medicare CMS Chapter 15 guidelines, when the patient is transitioning like that, there is a justification for a new initial evaluation. With that, you would make the determination, okay, are the skills of a therapist required? Did you already make so much progress with the supplemental care that now the patient doesn't need any more Medicare covered services? If you make that determination, you could just do an evaluation, discharge to the home program, have the recommendation within the home program that the patient will be receiving non-covered maintenance. Now, I understand there's covered maintenance programs, but in this case, it could be a non-covered maintenance program in which the patient has chosen to continue to work with you. You've made them aware of the financial responsibility. You could potentially have issued them an advanced beneficiary notice form, which I've covered in another video, and you would continue to deliver service on a self-pay basis. In regards to, do you have to continue to have a signed plan of care? I would tell you to reference your state practice act. And it's important that we differentiate between what are the payer requirements and guidelines and what are the state requirements and guidelines. Your state may still require you to complete or have an active plan of care in place. I don't think there's anything wrong with that. Perhaps you're trying to save a little bit of time on documentation. I totally get it. But it's probably a good thing to continue to have a plan of care in place. You do not need a physician signature unless your state practice act requires you have a physician signature. Yes, I would say that the continuity of services would still be self-pay because during the evaluation you've determined there's no need for the skills of a therapist. Now, if there was a major event, a major change, something happens, obviously you come back in as the Medicare Part B physical therapist or occupational therapist, some cases speech language pathologist. But based on the information you provided, I would say number one, when you say how do I transition to a coaching role, you're already in a non-therapist, non-Medicare covered, non-medically necessary role. So you're not really transitioning into anything else. Two, I would probably continue to have a plan of care in place. You can make the determination based on State Practice Act if you need a signature on that. And number three, from everything that you've shared, yes, it's probably a self-pay service. You might have justification to provide occasional or intermittent Medicare covered maintenance visits where you're assessing progress, updating the existing plan of care, teaching the patient new activities, but that would, based on Medicare guidelines, be, quote, an infrequent occurrence. So I hope that was helpful. But most of your question goes back to making sure you understand your State Practice Act. Guys, if you have questions like that, let me know. Post them in the comments. Join the Facebook group, Medicare Billing for Mostly Cash-Based PTOT SLP, and I'll see you on the next video.